What does healthcare look like in the future when it comes to voice technology? That's the question that we're going to tackle, and specifically from the Canadian perspective in these brief few minutes. My name is Dr. Teri Fisher. I am a sport and exercise physician and clinical assistant professor at the University of British Columbia in Vancouver, Canada. And I'm a huge voice tech enthusiast. I have a podcast called Voice First Health, and I love thinking about and imagining the future with voice tech. So with that, I want to take just a moment or two and talk about why I think voice is so important as we go forward in the future with regards to the whole healthcare journey. There are 5 main reasons, and coincidentally, using the letters of voice, VOICE, I think we can summarize those quite nicely. V stands for versatile. Voice is versatile, and that means that we can multitask when we are speaking or listening to someone speak. We can drive, for example, but you can't text and drive, or you can't read and drive. That's a very important distinction when it comes to speaking versus other types of communication. So voice allows us to do almost anything at the same time as speaking and listening. O stands for omnipresent. Voice is sound, and sound envelopes you, just like the trees here in this forest. If someone says my name behind me, I'm aware of that. And so voice is always on and available. It completely envelopes us with the sound of the spoken word. I stands for innate. When a baby is born, the first thing that baby does is it cries. It uses its voice instinctually to let us know that that baby has arrived. And it's something that makes the communication through speaking very human. It's the most natural way that we know how to communicate with each other. C stands for contextual. Unlike an email where perhaps you're not sure if someone's trying to be sarcastic or funny, in voice you can hear the emotion and you can tell if someone's excited or sad. Also, you can use vocal biomarkers and actually hear disease states in a person's voice. And so voice is expressive. It varies based on situational circumstances and can reflect emotional or physical states. And finally, E stands for efficient. Voice, in fact, is 3 to 4 times more efficient than typing, for example. And that means that it is the most time-effective way that we know how to articulate our thoughts. And because of all of these reasons, this is going to transform healthcare, among other industries, but healthcare here specifically in terms of the whole healthcare journey. Now let's talk about this from the Canadian perspective. I'm a Canadian physician, and one of the things that I'm very proud of is our public healthcare system where everybody does have access to these services. However, that means that there is a big problem. And that means that access to the healthcare is a big issue. The wait times, whether it's to see a family doctor, whether it's to see a specialist, whether it's to have surgery, are some of the longest in a particular study that was done among some of the developed countries. But what's also interesting is that when they surveyed the same group of people, they found that 74% of people said that they receive excellent or very good care, whereas the 11-country average was 65%. What does that mean? It means that Canadians are happy with the quality of care, but it's the access that is the problem. In other words, the problem is not the quality of care, but access to care. How can voice help us with that? Well, that's the big question. The way I see it, there are 4 different levels of the way that voice technology can impact the healthcare journey. Level 1 being educate, level 2 being advising, level 3 being diagnosing, and level 4 being treating. And what you'll notice is that the ease of implementation of each of these levels does get more challenging as you progress along that continuum because things become more regulated and there's more risk. However, the clinical impact is also tremendous at the end of the spectrum. So if I kind of get out of the way here, you'll see that I've sort of rated these, given them 4 stars. Ease of implementation is actually easiest at the beginning. The clinical impact is most impactful at the end of the continuum. So let's go through a couple of examples of each of these levels. Level 1, and remember these are just tip of the iceberg examples. There are so many other things going on. Level 1 is to educate. The Alberta Health Services. Alberta is one of the provinces in Canada. They were the first public healthcare organization in Canada to offer healthcare information on Google and Amazon devices. They provide wellness tips, things that include nutrition, exercise, sleep health, weight management, injury prevention, and stress management, ways that you can educate a patient. They also provide real-time estimated wait times for emergency departments, immunization clinics, etc. That's very interesting to me because it's starting to provide personal information, and it's helping to allocate the resources in Canada. Let's talk about an example of a level 2 voice interaction where you can advise. So there's this skill called Drug Finder. It's expert advice to help make smart drug choices. It searches an evidence-based list of drugs reviewed by independent panels of doctors and pharmacists, and it recommends drugs based on efficacy and cost. So a person who's on a medication can simply talk to a device, have a conversation, and find out which specific medication would be best for them. It is advising them. Let's move on to diagnosis. This is where things start to get very exciting. McGill University did a recent study. They looked at a voice-enabled COVID screening tool where participants were screened for the signs and symptoms of COVID by an Amazon Alexa device. And they also were screened by a healthcare provider to look at that reliability, the inter-rater reliability. And what was found was that the reliability was 0.992, with 1 being a perfect score. So you can see that this is immensely correlated, and it shows the value of being able to screen by voice, and imagine the burden that removes from a healthcare provider. And finally, treating. As far as I'm concerned, I've yet to see the best example of this, and this I think is the holy grail, because if you can start to provide health promotion, personal guidance, non-invasive diagnosis, and treatment at home, now you've brought the whole healthcare journey into the home. Imagine waking up, not feeling well, having a discussion with a voice assistant, it going through your history, figuring out what's going on, diagnosing you, figuring out what needs to be done, and perhaps having a medication shipped to your home. You haven't left your bed. And that is a personalized healthcare journey from the comfort of your home. That will have a tremendous benefit of easing the burden on the healthcare system. It will be like having a whole healthcare team in a device. And when you take a device and you put that into homes, to one home, many homes, now you've got individualized, personalized, little mini medical clinics throughout communities. And that will be the starting place for the healthcare journey for the patients and for the population. And of course, healthcare providers will be there when needed, but this is going to be how it will start. Voice technology is really exciting, and I think it is the future. And these are just, again, the tip of the iceberg. I encourage you to contact me. I'm at Dr. Teri Fisher on Twitter. You can check out the voicefirst.health.com website or drterifisher.com website. And before I go, I just want to take a moment and thank the Open Voice Network, Jon Stine, for the tremendous sponsorship for this. As well, I want to thank Vitalis Health for putting on this tremendous conference. Thank you for allowing me to be part of it, and I look forward to seeing you all in person really soon.